Misty Morris. I am new as a nurse manager. Yes, so I run two divisions or departments in maternity. So I run a high-risk antepartum unit and then also a high-risk postpartum unit. One is 13 beds and one is 18 beds. So I do think when you're in OB and in the maternity world, I work with high-risk moms. So I think a lot of these patients come into the hospital, or you expect when you're pregnant, that it's going to be this amazing, joyful experience. And sometimes there are hiccups along the way, and it's not necessarily what you planned for your pregnancy. So I think truly understanding that and understanding that these patients may be very stressed out when they didn't expect to, and really changing like their outlook on the situation and understanding that it's okay, it's happening for a reason, and truly making an impact on their birthing journey, honestly. We had a patient come in who unfortunately got diagnosed with cancer very late in her pregnancy. The pregnancy hormone was feeding the tumor. She got diagnosed and unfortunately had a terminal outcome. In the process of that, she did want to get married. So we planned a wedding for her, and we did something downstairs in the chapel, and her husband were able to get married. He was able to adopt a child from like her first marriage. So it was sweet to be able to kind of make that true impact. We still keep in touch, babysit, and still are very much kind of a part of my circle now. So that was special. So it started actually here when my dad was ill, and my dad unfortunately passed away when I was in high school. I thought I was going to be a vet and I was going to save animals and live on a farm. And I was truly like at a point here where I was really sad and felt very broken. And I remember this nurse, her name was Mary. She had a crisp white skirt, very crisp white shoes, a hat on, because this was, 25 years ago. And she like hugged me and was like, honestly gave me more support than my family. And in that moment, I said, I think I want to do this, which is very different from how I thought my life was going to end up. If no one in my family is in healthcare, I'm the first one, and now I'm back here working in that same hospital. So I started at Queens with my associate's degree in nursing, and then worked and pursued my bachelor's, and then from my bachelor's, I'm now pursuing my master's degree, but started with an associate's as a 2-year degree. Prior to that, worked in a nursing home as a nursing assistant for 7 years while I was kind of figuring out my nursing career, my journey. So to do this job well, I feel like one of the things that kind of I go by, it's not really a quote, but I do feel like you have to like hire the heart and you can train the brain. So when I'm even interviewing people or nurses, like I can teach you the skills, but I can't teach you how to be compassionate. So that's something that's really important to me. So I think you have to have compassion and your heart has to be in it because it can be stressful. If you're interested in healthcare, I just say go for it, honestly. I feel like it's one of the best jobs where you can work 5 days a week, 3 days a week. You can be a weekender and just work weekends. As far as like that work-life balance, it's something that you truly can have in healthcare. So yeah, my team is my family. So you think I started my nursing career, like I said, 15 years ago at Atrium, and I have stayed on that same unit for 15 years, which some people I think can feel like that might limit you on your skills, but I mean, I've been a part of birthday parties, celebrations. When I've had traumatic times in my life, my work family has really been my family. So the bond is there. And I think that's just important to have each other's back and just to really support one another outside of just clocking in and being here in these 4 walls.